I'm Jessica Gall. I'm doing this physical exam skills video.
My name is Darren Himes. I consent to being in the video.
Okay, Darren, so I'm going to be doing a head-to-toe assessment on you today. I'm going to start out with your head. Do you have any unusually frequent or severe headaches?
Nope.
Okay. So it's symmetrical and smooth. I don't feel any unusual lumps or depressions. I noticed some alopecia at the vertex and frontal scalp. Is that a new issue?
That's been gradual.
It's gradual, okay. And do you have psoriasis?
I do.
Okay, how long has that been?
Since I was a teenager.
Since you were a teenager, okay. All right. So I'm just going to examine your eyes. So I just want you to look straight at my nose. Okay, the corneal light reflex is intact. There's a little dot on both eyes. The pupils measure about 4 millimeters at rest, and they are equal and round and reactive to light. Okay, so just look over there. Turn this way. Okay, and the pupillary light reflex is intact as well. I get direct and consensual construction. All right, now I just want you to follow my fingers with your eyes without moving your head. Okay, good. So the eyes follow in parallel alignment together, and they converge when an object comes near to them. Now I'm just going to look at your conjunctiva. You just look up as I'm pulling down. Okay, and it's clear and glossy and moist, and the sclera is white. Okay, do you have any difficulties with your vision?
I don't.
Any eye pain?
Nope.
Any watering or discharge? Okay. And for your skin, especially on your head and your eyes, do you wear sunglasses, sunscreen, hats?
I wear a hat occasionally. No sunglasses.
Okay. I would just recommend you wear sunscreen to protect your skin, cancer. And the eyes, unprotected sun exposure can cause macular degeneration and cataracts, okay, and astigmatism. So just to prevent that, okay? All right, so now I'm just going to look at your ears. So the external ears are normal and equal in size and shape, and they're in normal alignment on the head. I'm just going to look at the external auditory meatus. There's no redness or swelling, or discharge or lesions of any kind. What about difficulties with your hearing?
I don't.
Okay. There's no ear pain? Okay. What about ringing?
Yes.
You have ringing in your ears? Both ears?
Yes.
For how long?
Since I was a kid.
Okay, so it's a chronic issue. Okay. All right. And do you expose yourself to loud noises? Earbuds. Yeah. Okay. I know it's fun, but just turn it down a little bit to protect your hearing for the future, okay? All right. So your nose, the external nose is symmetrical and midline and in proportion to the rest of his facial features. And I'm just going to take a look up. So you just tilt your head back. Okay. Do you have any difficulties with sense of smell?
No.
All right. Any trauma to the nose?
No.
Nosebleeds?
No. Oh, yes. Oh, wait. I do.
You have nosebleeds?
Mm-hmm.
Okay. All right. So just, especially in the cold weather months, it's common.
Mm-hmm.
Okay. Just make sure the humidity in your home it's not too dry, okay, because that can dry out your mucosa and cause the bleeds. Just going to press on your sinuses. Any pain?
No pain.
Okay, good. Alrighty. So I'm just going to look in your mouth. Do you have any sores or lesions that have been bothering you?
No.
Okay. Do your gums bleed?
No. Oh, wait. They sometimes when I floss.
They do. Okay. What about sore throats?
No sore throats.
Okay. Just open your mouth, please. Okay. All right. I don't see any white patches or nodules or ulcerations or anything like that. Okay, and the dorsal side of the tongue has the papillae, lift up your tongue. Okay, and the ventral side is glossy and moist and has the veins. Right, I just want you to stick your tongue out. Okay, and cranial nerve number 12 is functioning. There's no tremors or it's not deviated to the right or to the left when he sticks it out. Okay, now I just want you to say ah.
Ah.
Okay, and the uvula and the soft palate rise in the midline. when he does that. So that's cranial nerves number 9 and 10. For the bleeding gums, you don't floss daily, right?
Not daily.
Okay. I recommend flossing daily. Make sure you brush your teeth twice a day, okay? Keep your gums and mouth healthy.
Yes.
Okay. So now I want you to close your eyes. I'm just going to be touching your face. Does it feel the same on both sides?
It feels the same.
Same?
Same.
Same?
The last one was not the same.
Okay, good. All right, so we were able to feel light touch, and you can tell it's less than magical. Okay, so now I'm just going to ask you to make some facial expressions. So smile. Okay, close your eyes tight. Open them wide and raise your eyebrows, and puff out your cheeks. Okay, good. He has full mobility of his facial muscles and symmetry, so it's cranial nerve number 7. All right, so now I'm just going to take a look at your neck. Okay, and it looks symmetrical, no significant difference in the musculature, there's no unusual lumps or pulsations. I'm just going to feel your lymph nodes, okay? Do you have any neck pain?
No.
Any limitations in your range of motion?
No.
And struggle a little bit for me? Any pain when I was touching any of those?
Nope.
Okay. All right, and the lymph nodes were not enlarged, which you would get if they're some sort of infection. Okay, so I'm just going to palpate your trachea to make sure it's midline where it's supposed to be. Okay, and it is. There's no tracheal deviation. All right, so now I'm just going to check your thyroid. Okay, you swallow. Okay, the thyroid tissue moves up when you swallow. And turn a little bit. Turn it up. Okay, again. Okay, good. So there's no enlargement of the thyroid. Okay, I'm just going to check your carotid arteries. Oh. Okay, good. And they're equal on both sides, equal force. Just going to listen for bruits. Hold your breath. Don't hear any. Relax, and then hold your breath again. Okay. There are no bruits. Okay, so now I'm just going to listen to your lungs, okay? Do you have any history of asthma or bronchitis, anything like that? What about a cough?
No.
Okay. What about any shortness of breath when you're at rest?
No.
Okay. If you just take your shirt off for me and turn this way, just listen on the back first. And I want you to take a nice deep breath and then breathe out through your mouth, okay?
Uh-huh.
Okay, very good. You just turn forward. I'm going to do the same thing on the front. Okay, very good. All right, so I heard the nice rustling, swishing sounds, vesicular lung sounds, which you would hear over most of the peripheral fields. I didn't hear any crackles or bronchi or wheezes. Okay, so now I'm just going to listen to your heart. Do you ever have any chest pain?
No.
What about any heart palpitations, feeling an irregular beat?
I did over 5 years ago before I got back into shape.
Okay, but not in the last 5 years?
Not in the last 5 years.
Okay. All right. What about any difficulty breathing when you're laying flat?
No. Not at all.
No. Okay. I'm just going to listen, okay? Okay, the rhythm is regular, and S1 and S2 are nice and crisp. They're not diminished or accentuated, and I don't hear any extra heart sounds or murmurs. Okay. All right. So next, I'm gonna listen to your abdomen. So I just want you to lay flat for me, please. All right, do you have any food intolerances?
Nope.
Any heartburn or indigestion?
Nope.
What about constipation or diarrhea?
Constipation about once a month.
Once a month. Okay. How long does it last for?
About a week.
Okay. What do you do when that happens?
I drink extra water.
Okay. I would also say to add in some fiber and physical activity, okay, because those will also help, not only to prevent it, but to, once you have to treat it, okay? So listen for your bowel sounds. Okay. Bowel sounds present in all quadrants. I'm just going to also listen to your aorta to make sure there's no bruise. And I don't hear any. All right, so I'm just going to lightly touch your stomach, okay? Okay, no muscle guarding or rigidity there. I'm going to press a little harder and tell me if there's pain, okay? Pain?
No. 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 No.
Okay, good. All right, so I'm just going to palpate your spleen, make sure it's not enlarged. I'm just going to reach across you, okay?
Mm-hmm.
Relax. Okay. Take a deep breath. Okay. Not able to palpate the spleen. I'm not supposed to be able to. Right, then I'm going to do the same thing on the other side to check your liver, okay?
Yes.
My hands here. Relax. Take a deep breath. Okay. And I am able to feel the border of the liver, touch my fingers when he inhales, which is normal. I'm just going to check the height of the liver or the liver span. That's my first dull point. Okay. So it's supposed to be between 6 and 12 centimeters. That is a normal liver span. And his is about 10 and a half. So that's within normal range. He doesn't have hepatomegaly. Okay, so now I'm just going to ask you to sit up. Put your hands out. Okay. Just check the temperature, nice and warm. Check capillary refill. Less than 2 seconds. Okay, so I just want you to web your fingers out nice and strong. I'm going to push your fingers together, okay?
Mm-hmm.
Okay. He's got good muscle strength in his fingers. I just want you to take my hand and squeeze. Okay. Good muscle strength also in his hands and equal in both. Okay. Turn towards me a little bit. Okay. Push your hands up like this. Okay. I'm going to push against them. You push towards me, okay? Okay. Other way. Okay, good. He's able to maintain flexion against an opposing force in his upper extremities. Okay. So let's push your legs down. And I want you to just be loose, okay?
Mm-hmm.
I'm just going to bring this up. Let me do all the work. Okay, good. Other side. All right, passive range of motion, no spastic movements, and there was mild resistance, which there is supposed to be. Okay, so I'm going to just press down here. I just want you to lift your knee straight up to the ceiling. Okay, good. Do you have any joint swelling?
Nope.
Joint pain, muscle weakness? No? Okay. About how much walking would you say you do a day?
It's like 2 miles.
2 miles? Okay. They recommend about 10,000 steps, which is for most people about 5 miles. Okay, so just try to up that. Keep your muscles and your bones healthy and strong. Okay. All right. So I'm just going to be checking your lower extremities. So I want you to push against my hand. Okay, so do both sides. Push against my hand. Okay. Push forward. Okay. Out. And in. Okay, good. Alrighty, very good. Now I'm going to check your reflexes, okay?
Mhm.
Just relax.
Mhm.
Okay, good. We got the knee jerk. Okay, very good. And we're going to do the same thing with the Achilles, okay?
Mhm.
Okay, that's pushing my hand. Okay. All right. I'm going to take a look at his legs. All right. And they are equal in size. And I don't see any atrophy. Just going to check his pedal pulses. Okay. And they are both palpable and they're equal. All right. So finally, I'm just going to have you just sit there. I want to check the range of motion in your neck, okay? All right. All right. So I just want you to right ear to right shoulder, left ear to left shoulder, back to neutral. Rotate to the right, rotate to the left, extend your head back, and flex forward. Okay, good. He has full range of motion in his neck. So now I want you to stand up. Okay, so we're just going to check the range of motion in your upper extremities, okay?
Mhm.
So I just want you to bring them all the way up. Okay, all the way back and behind you. Okay, and then bring them out to the side. Okay, and down in front. Turn your hands so the backs of the hands touch each other, and then bring it up. Okay, any pain with that?
Nope.
No difficulties, you have full range of motion, no crepitation with movement.
Mhm.
Okay, and finally, I just want you to turn around. We're just going to check for scoliosis here, okay? So I'm going to put my hands on your hips, bend forward. Okay, he's able to bend 75 degrees, smooth, controlled movement, stand up. All right, and there's no lateral curvature of the spine, no evidence of scoliosis. Okay, Dennis, that was your head to toe assessment, okay?
Okay.